Hello, 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 and welcome to Nursing News You Can Use at 5. I'm Tina Baxter, your host. Today is September the 24th, 2025, and very excited to be here with you today. We have a lot to cover for news, so we're just going to get right into it. This is our affirmation for today. It's impossible to hold on to the past and seize the day at the same time. I'm going to say that again. It's impossible to hold on to the past and seize the day at the same time. That's from the You Are a Badass calendar by Jen Sincero. All right, let's get into the news because we got a lot to cover. This is our first story out of the great state of Ohio. It says 30,000 Ohio children stripped of health care while billions given to rich, a stain on Ohio. So this is coming from cleveland.com. And it says, since 2022, 30,000 Ohio children have lost health insurance because of cost concerns, while the state has provided billions to the wealthy in tax cuts and billions to private schools. Hosts of Today in Ohio, the Cleveland.com and Plain Leader News podcast discussion said Wednesday that connecting the two policy outcomes is key for people to understand how the state is being governed. They painted a devastating picture of misplaced priorities that betrays Governor Mike DeWine's promise to be a champion for the children. 30,000 kids. That's 30,000 kids in our state who have lost health coverage since 2022 up through 2024, said Courtney Astalafi, citing findings from the Georgetown University Center for Children and Families. This number pushes the state's child uninsured rate up to 5.6%, and compare that to just 4.5% a couple of years earlier. The timing of the coverage losses coincide with the end of the pandemic era protections that had kept people enrolled in Medicaid and CHIP. I have to say, we've certainly seen some similar problems with continuing enrollment too in the state of Indiana. Let's go on. When federal protections expired in early 2023, Ohio undertook a massive eligibility review that resulted in approximately 600,000 people being disenrolled, many of them children. What makes the situation particularly galling to the podcast host is how it contrasts with other fiscal priorities pursued by the DeWine administration and Republican-controlled legislature. Mike DeWine and the Republicans in the Ohio legislature on multiple rounds of budgeting now have given billions of dollars to rich people. They've cut their taxes over and over again to give wealthy people more money, Chris Quinn said. That's the Mike DeWine legacy. That's the Matt Huffman legacy. Let the kids go without health care so your wealthy friends get more money. This is such a stain on Ohio. The conversation placed these policy choices in the context of DeWine's early months as governor. Mike DeWine came into office saying, I'm going to be the children's governor. I'm going to make life better for children. And instead, they're giving $1 billion a year to a charity and private schools with almost no accountability. They're giving billions to rich people, and those kids go without health benefits. That's the Mike DeWine legacy. The host wondered what the coverage losses mean for Ohio families already struggling financially. Without insurance, parents face impossible choices about seeking medical care for their children, potentially postponing necessary treatments due to cost. Adding to their alarm, and this is the inspector of further cuts on the horizon. Astalafi noted that the federal One Big Beautiful Bill Act passed by the Trump administration and Congress slashes Medicaid by $1 trillion over the next decade, suggesting the situation could worsen for Ohio's vulnerable children. The podcast discussion paints a stark picture of a state government that hosts argue has abandoned its most vulnerable citizens, children, while catering to wealthy interests through repeated tax cuts. So if you want to hear more about that discussion and all that they had to say, head on over to the Today in Ohio podcast and listen to that. But if you're in Ohio, let me know what you think about this, because I know we've faced similar cuts to Medicaid here in Indiana. I want to know what you have to say about that. If you're in Ohio, let me know and share some insights. And if you are one of those people that were affected, how were you affected by these cuts? All right, here's our next story from McKnight's Long-Term Care News, and it says, HHS ending appeals of nursing home staffing mandate cases. The Department of Health and Human Services has asked two federal courts to dismiss its appeals defending a federal rule establishing nursing home staffing minimums. The U.S. Court of Appeals for the Fifth Circuit granted a motion to dismiss Friday, putting to bed a 16-month legal battle launched by the American Healthcare Association and a group of skilled nursing providers in Texas. HHS initially appealed both rulings. The White House late last month proposed a final rule that would repeal that mandate, pitting the two efforts at odds with each other and create confusion among some providers. The latest legal maneuvers bring the administrations, that's funny how they put that in there, ministrations in line with each other, making the staffing rules final defeat all but certain. The next round of written arguments were due in the AHCA legal case Wednesday, but attorneys for the Department of Justice, working on behalf of HHS, quietly filed a voluntary motion for dismissal in that court and in the U.S. Court of Appeals for the Eighth Circuit on Thursday, September 18. The Eighth Circuit had yet to grant a related motion, according to a check of records Wednesday morning. It has been handling an HHS appeal that seeks to overturn a district court ruling in favor of states' attorney generals and a group of leading-edge affiliates that challenged the mandate. The staffing rule is finalized in early 2024 and required around-the-clock registered nurse staffing at every nursing home in the U.S., as well as set a minimum overall nurse staffing hours and minimums for RN and certified nursing assistant coverage. Key elements were set to take effect starting next year. So at this time, they have pulled out of the appeal. So we'll keep an eye and see if there's anything that is changing in this. But it looks like that staffing mandate is now dead in the water. All right. Here's another story. We're talking about all healthcare related news. This is from Healthcare Dive. And it says emergency department deaths tick up following private equity acquisition, according to a study. Patients may be more likely to die in private equity-owned emergency departments and other similar facilities, according to a study published Tuesday in the Annals of Internal Medicine. Researchers found private equity acquisitions were associated with a 13% increase in mortality on average among Medicare beneficiaries in emergency departments. They attributed the increase to staff cuts after private equity buys, which reduced the ability of facilities to care for high-risk patients. It kind of reminded me, and I just watched this movie, which is why it's in my mind. Remember the movie Down to Earth with Chris Rock? If you haven't watched it, go ahead and watch it. It is a funny movie. But here's the thing. In the movie, the one of the big premises, besides the fact that, Chris Rock dies and ultimately needs a new body, right? But is that the person whose body he took over is backed by a private equity firm. He owns this big company, and they were buying a local hospital and basically privatizing the hospital and then driving up costs, reducing the amount of care. It's a good movie to see. And it was almost like foreshadowing of what we're seeing that's happening in our country right now. So go ahead and watch that movie. It was funny, but I just watched it and it just reminded me of, I see this happening in real life. Where, Chris Rock cracked the joke, if you got a bullet in the head, you get a bed. Well, we're showing that it does matter where you go to get your care. It says staffing cuts are one of the most common strategies used to generate financial returns for the firm and its investors, said senior author Zarul Song, associate professor of healthcare policy in the Blavatnik Institute at Harvard Medical School. Among Medicare patients who are often older and more vulnerable, this study shows that those financial strategies may lead to potentially dangerous, even deadly consequences. The research adds to the growing chorus calling for more oversight of private equity in healthcare. The investor-based private ownership model has been used to purchase hundreds of hospitals and nursing homes over the past decade, along with thousands of physician practices, according to the study. Private equity firms typically buy hospitals in hopes of selling them within a few years for profit. This model has generated wealth for investors, but garnered significant scrutiny from academics, providers, and lawmakers. Part of the concern lies in allegations that private equity owners cut resources and degrade care quality. The current study draws upon data from 49 private equity hospitals and 293 non private equity owned hospitals between 2009 and 2019. Researchers found emergency department salary expenditures declined by 18%, while salaries were cut by 16% in ICUs after facilities were acquired by a private equity firm. Although ICU mortality did not change, sicker ICU patients were now more likely to be transferred to other hospitals. And that was another key issue in the movie. It was kind of interesting. So if you want to hear more about this, go ahead and head on over to Healthcare Dive. They have more in this story. We just don't have the time to really delve into it as much as we can. But I'm raising these important issues here for you. Okay. Here's another healthcare related article. Of course, all of them are healthcare related, but this is one. And again, we don't wax very political on this channel except for when it impacts healthcare. So let's talk about this. This one is fear of deportation is keeping people from accessing healthcare. This was actually put on by our own WFYI, so I wanted to share this with you. Okay. Earlier this year, President Trump rolled back a policy that kept federal immigration agents from sensitive areas like schools and medical facilities. So we kind of talked a little bit about this last week. And the nurses that feel like they're caught in the middle, the nurses and the healthcare workers caught in the middle of this struggle. Okay, so let's get on to it. So it says, according to a report from Axios, there has been a 127% increase in ICE arrests in Indiana from January to June of this year. Doctors and others worry that this will have negative health impacts on some of the 11 million immigrants here without legal status. Lizzie McGrevy sat down with Ryan Levy, a reporter from Tradehouse, to talk about how fear is keeping people away from the doctor's office. So here's just a little bit of their discussion. And again, you can go on over to WFYI to hear the entire discussion yourself. But I just want to share some of the things that they said. So Mr. Libby said, absolutely. So research shows that this constant fear of deportation can harm people's physical and mental health. And this is especially true in kids. This kind of constant low-lying fear is often referred to as toxic stress. And studies have shown that it can lead to anxiety, depression, and PTSD, as well as increased risk of infection, diabetes, heart disease, asthma, and cancer. Lizzie went on to ask if that some were not attending their doctor's appointments or personal health appointments, and what are the experts are saying about this. And Ryan Levy goes on to say, yeah, so I talked with more than a dozen people who provide care to or study the health of this population. One clinic in Chicago told me that they've seen a noticeable jump in the number of people canceling or not showing up for appointments, as well as a big spike in people not picking up their prescriptions, especially at times when immigration enforcement is in the headlines. And these experts told me that they're really worried about people who stay away could see their chronic diseases like diabetes and hypertension get worse, and folks could miss critical preventive care like immunizations and cancer screenings. Cancer screenings were something that we saw being issued during the pandemic, during the COVID pandemic, which was another time when we saw a lot of people avoiding care. And so it went on to say that Steve Wilding, who runs a clinic in Chicago, which is called Community Health, she told me that they've been doing a lot more telehealth and reminding folks that other people can pick up their prescriptions. Just generally trying to find ways to put folks at ease. We're also seeing a lot of places train their staff on what to do if ICE shows up, and they're rearranging their waiting areas to be less public. And the biggest thing I heard kind of over and over again was providers are trying to communicate to their patients that it's safe for them to come in and it's important for them to come in. Though Steph and everyone I talked to also acknowledge that there's a limit to the safety they can promise their patients right now. So if you want to hear that entire story, head on over to WFYI for this story and find out more what's going on. Okay, this was another interesting article that I just came upon. This is from Skilled Nursing News. And it says, GoNage census to seize the moment nursing homes must mirror hospitals, AI use, and unburden staff. We're going to talk more about the use of AI and other things in healthcare as we go on. So while census remains a strong at nursing homes, certain factors such as insufficient hiring of skilled clinical workers and limited use of technology and AI tools to align with referral partners in hospitals could negatively impact census. Andy Frazier, COO of Larry H. Miller Senior Health, and Steve Hart, COO of Heritage Operations Group, shared insights into how their organizations are maintaining high occupancy and preparing for future growth at Skilled Nursing News Rethink Conference. Aside from reducing aging agency staffing and using technology and data from referral sources to improve conversion rates, providers need to be aligning care and admissions teams better to accept more referrals and stabilize their facilities' census. Providers could also benefit from cutting staff burdens. For Heritage, too, facility census has been great overall, but keeping it in good shape has been hard work and has been implementing new initiatives. So on the high end, we tend to occupy every bed that we hope to fill. That's probably the majority of our buildings, at least in rural Illinois. On the low end, if we're looking to add maybe 10 residents to a building, we can tend to achieve that goal maybe in a few months. For Heritage, even though quality staffing is still hard to get, he said that at least the reduction of agency staff has made it easier to accept weekend admissions, which can impact census growth. Reducing burdens on staff through successful initiatives that have eased tasks such as medication passing has proven to be critical. Heritage collaborated with Green Tree Pharmacy to streamline medication packaging. The change resulted in cutting medication pass rate by more than half, which significantly boosted staff morale, he said, and helped expand census capacity. The nurses were on a choke point on their ability to safely care for residents, and now their workload has significantly decreased. Illinois based Heritage owns and manages over 40 senior care facilities throughout the state. Meanwhile, Frazier described Larry H. Miller's staffing as fragile, adequate but lacking depth of skills, and yet the census has remained strong. But Frazier has said admitting more patients can lead to diminished quality of care. His organization has focused on workarounds, including more technology use and team collaboration. So, if you want to hear more about this story and what you can do, head on over to Skilled Nursing News to get more information on that. So, the use of technology and improving the workflow for nurses in nursing homes and others, that are working in nursing homes is going to be key and critical going forward. All right, let's get to our next story. All right, so this is from the Independent. It says health warning issued as drug resistant nightmare bacteria infections continue to rise. Infection rates from drug resistant nightmare bacteria rose almost 70% between 2019 and 2023, according to a new report for the Centers for Disease Control and Prevention scientists. Bacteria that are difficult to treat due to the so called NDM gene primarily drove the increase. CDC researchers wrote in an article published Monday in the Annals of Internal Medicine. Only 2 antibiotics work against those infections, and those drugs are expensive and must be administered through an IV. Bacteria with the gene were once considered exotic, linked to a small number of patients who received medical care overseas. Though the numbers are still small, the rate of U.S. cases jumped more than fivefold in recent years. The rise of NDMs in the U.S. is a grave danger and very worrisome, said David Weiss, an Emory University infectious disease researcher. It is likely many people are unrecognized carriers of the drug-resistant bacteria, which can lead to community spread. That may play out in doctors' offices across the country as infections, long considered routine and easy to treat, like urinary tract infections, could become chronic problems. Antimicrobial resistance occurs when germs such as bacteria and fungi gain the power to fight off the drugs designed to kill them. The misuse of antibiotics was a big reason for the rise. Unfinished or unnecessary prescriptions that didn't kill the germs made them stronger. In recent years, the CDC has drawn attention to nightmare bacteria resistant to a wide range of antibiotics. That includes carbapenems, a class of antibiotics considered as a last resort for treatment of serious infections. The rate of carbapenem-resistant infection rose from just under 2 per 100,000 people in 2019 to more than 3 per 100,000 people in 2023, an increase of 69%. But the rate of NDM cases rose from around 0.25 to 1.35, an increase of 460%, the authors said. A researcher not involved in the study said the increase is probably related to COVID-19 pandemic. We know that there's a huge surge in antibiotic use during the pandemic, so this is likely reflected in increasing drug resistance. The CDC count is only a partial picture. Many states are not fully testing and reporting cases. Even in states that do, cases tend to be among hospital patients sick enough to warrant special testing. Many hospitals also aren't able to do the testing needed to detect the certain form of genetic resistance. So, if you want to hear more information, go on over to this. You can read the original article in the Annuals of Internal Medicine, and this is come from the Independent. All right, we'll have one more story before we head to a brief break. From CBS Sacramento, Kaiser Permanente nurses protest to call attention to layoffs, AI use in hospitals. Nurses protested at 22 Kaiser Permanente facilities across the state of California on Tuesday, saying they want to call attention to layoffs, wage theft, and the use of untested technologies as artificial intelligence becomes more commonly used in the hospital setting. And can I just say, the use of AI in healthcare, it has its place, but we really do need to proceed cautiously. My concern is what happens to the data that's collected. How do you know that it's accurate? Will it hallucinate something? Because we have heard of that, and there's been a legal case where an attorney is actually sanctioned because he turned in documentation about a legal case that didn't exist because AI hallucinated. So you don't want that to happen in a medical setting because that could be life or death. So I do have some concerns about utilizing AI in healthcare if we aren't doing it in a proactive, measured way. Anyway, let's get back to it. So outside and I'm probably going to say this wrong, but I think it's Vacaville, if I remember correctly, Vacaville Medical Center. A few dozen nurses joined in on the nationwide demonstration. Kaiser Permanente leadership told CBS Sacramento that this demonstration was not a strike and that there was no disruption to hospital service Tuesday. The nationwide effort is to keep nurses at the bedside and not replace us with AI technology, said Gina Macalino, a registered nurse in Vacaville. Nurses CBS Sacramento spoke with on the picket line say some AI use in the right context is fine, but they fear certain uses are already going too far. Nursing is a science, and we believe that computers can never replace the care that a nurse can give a patient. Nurses say that they fear what is right now a gradual implementation of AI could one day mean the technology takes their jobs if they're not part of those conversations today about what it should look like and what is safe for their patients. We feel the power of touch is healing the people instead of a computer that can misdiagnose you. Kaiser Permanente leaders said that in their facilities, AI tools do not make medical decisions and can be used to benefit both patients and staff members. Kaiser right now is attempting to lay off nurses in San Rafael and the outpatient setting, and we have a feeling that this is going to spread throughout, said Macalino. There we go. Those pending layoffs next month in San Rafael will impact 41 nurses. A Kaiser Permanente spokesperson told CBS Sacramento that the layoffs reflected a needed rebalance of resources post-pandemic, and the quality of care will not be affected. They added that 21 of those impacted nurses have already been redeployed into positions. Still, the California Nurses Association is fighting back against the layoffs, calling them profit-driven and claiming Kaiser is replacing the nurses with cheaper telehealth computer-based alternatives. Running us short and running us with a bare minimum skeleton staff is not okay. They're raking in millions and billions of dollars in profits, and they need that money to go back into the bedside and help us take care of our patients. Here's the full statement from Kaiser Permanente, um, which I won't read the entire thing because it's just very long. But it says this one day informational picketing is part of a national campaign. National Nurses United, California Nurses Association is conducting refute any allegations that this picketing is about concerns of care quality and service at Kaiser Permanente. CNA is simply using this day of action as an opportunity to gain visibility for their union. It further goes on to say Kaiser Permanente is empowering nurses with state of the art tools and technologies that support our mission of providing high quality, affordable health care to best meet our members' and patients' needs. So I'm going to say this. First of all, if you want to read the entire statement, going over to CBS Sacramento to do so. But secondly, I wanted to say if you're in California and this is impacting you, let me know what's going on because I'm quite curious to see what's actually happening there and what type of AI technology are they introducing at the bedside for you. All right, let's go ahead and take a brief break and then we'll be right back. Tired of feeling trapped in a job that no longer fulfills you? Is your nursing job no longer the fun-filled adventure you imagined? Find your passion again through nurse entrepreneurship. Step out into the light and come feel the sun. Join the Nurse Shark Academy today at thenursesharkacademy.biz and come feel the sun. All right, let's get to our next story. All right, this is coming from Skilled Nursing News. It says long-term care pharmacy giant Omnicare files for bankruptcy, explores restructuring options. Long-term care pharmacy Omnicare has entered into Chapter 11 bankruptcy proceedings and is considering various paths forward, including a standalone restructuring or a sale. Omnicare is a subsidiary of CVS Health and provides pharmacy services to long-term care market, including skilled nursing facilities, independent living communities, and assisted living communities. The LTC pharmacy giant, which serves facilities in 47 states, is entering into Chapter 11 bankruptcy proceedings in the U.S. Bankruptcy Court for the Northern District of Texas. Omnicare has between 100 million and 500 million in assets, with somewhere between 1 billion and 10 billion in liabilities, according to court documents. Omnicare has arranged 110 million of debtor in possession financing, which the company leaders expect will provide sufficient liquidity to stay in business, with operations proceeding as normal throughout the proceedings. During the court-supervised process, Omnicare is continuing to provide safe and reliable pharmacy services to long-term care facilities. Omnicare customers and patients can expect to continue to access pharmacy and clinical services without disruption. Omnicare declined to comment on how many customers it has. The company's Chapter 11 filing is linked to recent litigation in the U.S. District Court for the Southern District of New York. In April, Omnicare was found liable for improperly billing the United States government, resulting in $135 million in damages in one of the largest damages verdicts rendered by a jury in a False Claims Act case, according to the U.S. Department of Justice. So basically what happens when you get a large judgment against you like that, the company then says, okay, well, we can't pay it, so we're going to file for bankruptcy so that you never actually will get the money and we don't really have to pay it. And then we'll go through the bankruptcy procedure. Then we'll do some finagling and change some structure and probably change our name and call it something else. And we'll be a new entity. And therefore, all that bad stuff goes away. So Omnicare was found to have distributed drugs that were not supported by valid prescriptions under state law between 2010 and 2018 and billed Medicare, Medicaid, and TRICARE. In July, a judge ordered Omnicare to pay $948.8 million in penalties and damages, which is a lot. David Azalina, president of Omnicare, said the district court imposed, quote, an extreme and unconstitutional penalty. Omnicare has been engaged in a civil lawsuit alleging technical violations of pharmacy law based on practices the government knew Omnico's care struggles predate the legal proceedings in the Chapter 11 bankruptcy filing. In 2022, CVS noted that its long-term care services business line was no longer a strategic asset, and the company explored selling it. But the company halted its sale expiration in 2023 after determining the pharmacy's value to CVS exceeded what the company would get in a sale. So we'll continue to see what follow this along. If you have any insight into it, let me know. You want to hear more? Head on over to Skilled Nursing News right now. Okay, this is a press release from the Massachusetts Nurses Association, and it says MNA nurses and healthcare professionals, Boston University public health professor, to testify September 29th on legislation to preserve essential health services. The ongoing crisis of hospital corporations closing emergency departments, maternity units, behavioral health units, and other essential health services will come under scrutiny during a State House hearing on Monday, September 29th at 9 a.m. Nurses, healthcare professionals, advocates, and experts will testify in support of two bills that would strengthen the Commonwealth's ability to protect access to healthcare services and keep hospital services open if the DPH deems them necessary. Since 2009, more than 40 hospitals or units have closed in Massachusetts. In nearly every case, the Department of Public Health determined the services were essential to preserving access and health status in the community, and yet the closures went forward. Nurses and healthcare professionals have long said this process demonstrates the weakness of the state's current law when it comes to preserving access to necessary care. This became particularly clear during we're back to it again, Stewart crisis, back to Stewart Healthcare, where 8 hospitals were threatened with closure, and the state said it was powerless to keep them open. 2 of those hospitals were closed, and the state has no process for when this happens again. Massachusetts law has failed patients for too long by allowing corporations to close essential healthcare services, even though public health officials deem them necessary, said MNA president and practicing ICU nurse Katie Murphy. Access to essential services has declined across the Commonwealth because our healthcare system follows a corporate, profit-driven model, and our state has limited powers to ensure patients can receive necessary care. Our healthcare system and laws must reflect the needs of our community. We urge lawmakers to ensure that parents and babies, people suffering from mental health or substance use issues, and all of our vulnerable residents are able to access the care they need. So that will be, if you are in the Massachusetts area, this is going to take place. It's the Joint Committee on Healthcare Financing hearing on Act Assessing Healthcare Access, sponsored by Senator Julian, I think it's Sire, and Representative Michael Kushmerek and Representative Christine Barber. And then there's another act, an act preserving access to the hospital services, sponsored by Senator Paul Mark and Representative Margaret Scarsdale. So that will be Monday, September the 29th at 9 a.m. It will be at the Massachusetts State House in Boston, the hearing room A2. And there is a website for watching the proceedings remotely if you need to do that. And that information is available, so you can head on over to do that. So that was a press release that was released, but I thought it was really interesting to hear about because it goes back to what we were talking about with Stewart Healthcare and all the issues that have been happening from then. If you don't remember that story, go back to our earliest episodes and you'll see where we talked about extensively about Stewart Healthcare and the fact that allegedly the CEO and others that were in leadership received bonuses while the hospital itself was actually losing so much money that critical equipment was being repossessed. And ultimately, they were shutting down facilities. So this kind of goes back to our earlier story about what happens when private equity gets into hospitals and things like that. All right, so here we go. Here's our next story. Nurses file federal labor charge against Aspiris Ironwood. This is coming out of Michigan, Ironwood, Michigan. And it says nurses at Aspira's Ironwood Hospital have filed a federal unfair labor practice charge against the hospital. The union cites executives' refusal to return to the bargaining table. This comes on the heels of the hospital's announcement that it would end birthing services. So it goes back to what we were talking about earlier and the other in Massachusetts. It's not just in Massachusetts, it's happening other places where hospitals are cutting down services. Michigan Nurses Association union members at Aspirus Ironwood have been in negotiations with the Aspirus Hospital Administration for a new contract since May. The contract for the nurses expired August the 2nd, with the last round of negotiations happening on August the 21st. One Aspirus nurse said they just want to be heard. We just want a fair contract, said Ashley Thompson, Aspirus Ironwood Hospital RN. We want to be able to recruit and retain nurses. We want to keep our strong union voice. We want them to listen to us, and hopefully, after all this, they're serious about meeting with us and getting some stuff done. Since the contract expired, Aspirus has also announced on September the 5th that it would end labor and delivery services. Thompson says this change, in addition to the expired contracts, has made negotiations especially critical. We have some things we want to bring to them about that. We're working on a proposal about that closure. We're really not happy about that. We did have our rally last week, which was great. We had a great community turnout. They really seem to support us. They're upset too. It's not just the nurses that Aspirus has been disrespecting. It's the whole UP, meaning Upper Peninsula. The nurses union filed the unfair labor charge Monday. On Tuesday, Aspirus Health addressed that charge in an email statement saying, we have proposed to the Michigan Nurses Association a bargaining session for this coming Friday, September the 26th. While we wait for a response from MNA, we encourage the union to continue the discussion to find a mutually agreeable arrangement rather than focus on meritless labor practice charges. So we'll see what happens. We'll keep an eye on that story as it unfolds. This is from Ocala News. Ocala Hospital sues Rasmussen over patient's death caused by nursing student. This is an interesting case. This is at a HCA Florida hospital. Yep, we're going back to Florida. It seems like there's something always coming up in Florida every week with the Nightingale stuff, everything. So here we go. So in a lawsuit filed by HCA Florida West Marion Hospital, the organization claims that Rasmussen University student who moved an 82-year-old patient into a bed did so without assistance and direction, causing the woman to fall and suffer severe head injuries that led to her death. Which is an interesting case because you have the student that is working or learning at the facility. There's an incident. The question becomes, who's at fault, right? So Marion County Hospital Incorporated filed a lawsuit against Rasmussen College, which does business as Rasmussen University, in the 5th Judicial Circuit Court of Marion County on September 11th. According to the complaint, Stephen Knowles, who is now a registered nurse, was a nursing student taking part in the nursing program at HCA Florida West Marion Hospital in 2023. At the time, MCH, which does business as HCA Florida West Marion Hospital, had a partnership with Rasmussen, wherein the hospital made its facilities available for the college to use in various nursing programs. The lawsuit alleges that on April 22nd, 2023, around 1:35 p.m., Knowles allegedly attempted to assist a patient into bed at the hospital. Knowles was not assigned to the patient's floor, nor did he make any attempts to apprise himself of the patient's weight-bearing status prior to rendering aid. The document further alleges that Knowles did not notify the patient's primary nurse before he attempted to assist the patient. During his attempt to move the patient into bed without a second provider present, the patient fell to the ground and screamed in pain. The patient's scream alerted hospital staff, who immediately responded to the woman's room. Upon arrival, staff found the patient bleeding on the floor while Knowles stood to the right of the woman. As a result of Knowles' improper care, the patient sustained a subdural hematoma that caused a midline shift, which ultimately resulted in death, reads the lawsuit. So, if those who don't know, a subdural hematoma is a type of bleeding that occurs in between the brain and the skull after a head injury. The complaint alleged that Knowles failed to follow hospital policy and procedures and failed to appreciate that the patient was a high fall risk. As a result, he failed to use the proper fall precautions prior to moving a high risk fall patient. The hospital accuses the school of failing to ensure Knowles conducted himself, quote, in accordance with the hospital's policies and procedures. So again, that becomes a question of, were the students trained in the hospital's policy and procedures before they were allowed on the unit? And if that wasn't a patient he was assigned to or a unit that he was assigned to, why was he taking her to the bathroom or putting her in the bed or whatever? So there's a lot of questions in there, but again, we'll see what happens. It further accuses the school of failing to ensure that Knowles, quote, adhered to his training and orientation as a program participant. Furthermore, the hospital claims its agreement with Rasmussen included an indemnification provision that provided it would not be held liable for all third-party liabilities, claims, damages, and expenses. Okay. MCH claims that after the incident, the organization was sued for medical malpractice. It allegedly settled that lawsuit for an undisclosed amount on March 18th. On May 6th, the hospital allegedly sent correspondence to Rasmussen demanding that the school pay the cost of the settlement. On July 10th, the hospital sent additional correspondence, once again demanding the settlement to be paid by Rasmussen. As of the filing of the complaint, the hospital claims it has not received any proceeds towards the settlement. It is seeking an undisclosed amount in damages. It is represented by the law firm of Ferrantino and Bratz in Tampa. So this is kind of interesting because you have nursing students, and ultimately, nursing students usually are under the supervision of faculty and the floor nursing. So I have to say that's one of the reasons why it is our policy that our students do not transfer or lift. I'm talking about my CNA students. Transfer or lift patients on their own. They do not operate the Hoyer lift on their own. Those things do not happen. There is always a second person, which is why we pair people up, because we don't want this to happen. We don't want that to happen. So it's a safety measure for us as a training academy. This has been our policy. So I don't know if the student followed the policy from the college or not, but it's interesting to find that there's this thing where now they're saying, okay, well, it's the nursing student's fault. Therefore, because they were a student, they're not our employee. We're not responsible for the damages. So this is going to be an interesting take. Let's see what happens with that. And that may have implications then for other schools of nursing. Okay. We're going to go ahead and take this next story before we head on over to a quick break, and then we'll finish up. Okay. So this is from Healthcare Dive. Physician practice acquisitions on the rise. It says fewer doctors are employed by independent physician practices as offices are acquired by health systems, insurers, private equity firms, and other companies, according to a review of studies published Monday by the Government Accountability Office. For example, about 47% of physicians worked for or were affiliated with hospital systems last year, compared with less than 30% in 2012, according to a study by the American Medical Association cited in the report. Other research shows similar increases in consolidation between practices and hospital systems. Physician consolidation with health systems can lead to higher prices, as well as a decrease or no change in care quality, according to the report. However, the impact of consolidation with other entities like payers, private equity firms, or retailers was less clear or unknown. Acquisition of physician practices and worries. Consolidated will drive up prices and worsen care delivery is not a new trend in the healthcare sector. Physicians argue maintaining independent practice has become increasingly challenging as expenses rise faster than revenue, which included peer-reviewed studies and reports as well as interviews with industry stakeholders. Doctors also see acquisition as a way to use scale to negotiate higher payment rates with insurers, improve access to expensive resources, and lessen administrative and regulatory burdens, the report found. Additionally, selling practices is an attractive option for doctors looking to retire an important factor as the physician workforce ages. And as the number of independent doctors' offices dwindles, consolidation becomes even more likely for the practices still operating on their own. With greater consolidation, remaining independent practices may face additional challenges, such as reduced ability to negotiate contracts and payments with insurers or to receive referrals from other physicians. This could, in turn, lead them to look for partners to acquire or affiliate with their practice. Meanwhile, buyers see a number of benefits to acquiring physician practices. Health systems gain additional revenue for physician services while increasing the number of referrals to their hospitals for care. Plus, as a hospital system increases their market share, they could command higher payment rates from insurers, according to the analysis. Hospitals say operating physician practices also helps them to shift value-based payment arrangements, as owning doctors' offices allows them to coordinate care across settings. However, the analysis found some negative consequences of hospital-owned physician practices. Three studies found that higher Medicare spending was linked to delivering more services in hospital settings. One analysis found total spending on per Medicare patient increased by 5% for select elective surgeries from 2010 to 2015, in part due to by replacing doctors' office visits with pricier hospital outpatient visits. Hospitals argued spending could rise after an acquisition because of increased utilization. Plus, acquiring health systems sometimes incur costs to improve the financial stability of purchased practices. Physician groups saw another potential reason for cost increases, according to the report. Hospitals may expect primary care physicians to see more patients and shorter duration appointments, which can increase patient referrals for additional diagnostic testing or visits with specialists. Insurers are another type of buyer scooping up physician practices, though estimates of acquisition by payers varies. One study found about 2% of physicians worked in practices owned by insurers, though that likely doesn't include doctors and practices affiliated with but not owned by payers. Payers acquire physician practices to gain leverage when negotiating prices with other providers while lowering costs of care and pushing participation in value-based care. Additionally, owning or affiliating with physicians could give Medicare Advantage insurers more influence on how doctors document patients' health conditions, potentially increasing their reimbursement from the government by inflating beneficiaries' illness. The practice called upcoding has received scrutiny from lawmakers and regulators for driving up Medicare costs. Private equity ownership of physician practices is also on the rise, though investment varies by specialty and market, according to the GAO analysis. One study found about 6.5% of physicians worked at private equity owned practices last year, compared to 4.5% in 2022. The funds typically invest in practices and then sell the offices within 3 to 10 years. Private equity firms sometimes consolidate smaller practices to increase market share or negotiating power, or link practices under a management services organization to share administrative and financial work. So we'll keep an eye on that story as well. You want to know more, head on over to healthcaredive.com. All right. Let's take a brief break, and then we'll get back to our next story, because we're talking about everything tech and AI. So let's get to it. Ready to turn your nursing skills into a thriving business? At the Nurse Shark Academy, we give you expert strategies, real startup guidance, and the support to go from employee to empowered entrepreneur. Join us and build the nurse-owned business of your dreams. Start today and join us at the nursesharkacademy.biz. All right, so let's get to this next story here. I found this kind of interesting. It says, this is from the Daily Record, and it says a robot programmed to act like a 7-year-old girl works to combat fear and loneliness in hospitals. A robot programmed to act like a 7-year-old girl works to combat fear and loneliness in hospitals after Megan Brazos Sheehan's 6-year-old son was diagnosed with leukemia. They were walking down the halls of UMass Memorial Children's Medical Center when they ran into Robin, the robot. Luca, you can read the content and details. Let's see. So let's go down where it says days after Megan Brazil's Sheenan's 6-year-old son was diagnosed with leukemia, they were walking down the halls of the U.S. Mass Children's Medical Center when they ran to Robin the robot. I just said that. Okay, it says, Luca, how are you? It asked in a high pitched voice program that sounded like a 7-year-old girl. It's been a while. Brazel Sheehan said they'd only met the 4-foot tall robot with a large screen displaying cartoon like features once before after they were admitted several days earlier. His face lit up, she said, about the interaction in June. It was so special because she remembered him. Robin is an artificial intelligence therapeutic robot programmed to act like a little girl as it provides emotional support at nursing homes and hospital pediatric units while helping combat staffing shortages. 5 years after launching in the U.S., it has become a familiar face in 30 healthcare facilities in California, Massachusetts, New York, and Indiana. Nurses and medical staff are really overworked, under a lot of pressure, and unfortunately, a lot of times they don't have the capacity to provide engagement and connections to patients. Robin helps to alleviate that part from them. As AI increasingly becomes part of daily life, it's found a foothold in medical care, providing everything from note taking during exams to electronic nurses. While heralded by some for the efficiency it brings, others worry about its impact on patient care. Robin is about 30% autonomous, while a team of operators work remotely controls the rest under watchful eyes of clinical staff. With each interaction, they're able to collect more data while still complying with the Health Insurance Portability Accountability Act, or HIPAA, and get closer to being able to function independently. Imagine a purely emotional intelligence like Wally. We're trying to create that, he said, referencing the 2008 animated film that was Kachi Khan. I don't know, I'm not going to spell his name or say his name right. On a recent Friday, a staff member at Health Bridge Children's Hospital in Orange County, California, read off a list of patients she needed Robin to visit, along with the amount of time to spend with each one. The robot with a sleek white triangle-shaped frame said that was designed for hugging, rolled into a room with a teenager injured in a car accident. The robot played what it described as his favorite song, No Fear by D.E.J. Loaf. I don't know what that is. And he danced along. In the hallway, Robin cracked up a young child held by her mother when it put on a series of silly glasses and a big red nose. In another room, the robot played a simplified version of tic-tac-toe with a patient. Samantha Da Silva, speech language pathologist at the hospital, said patients light up when Robin comes into their room and not only remembers their names, but their favorite music. She brings joy to everyone. She walks down the halls. Everyone does to chat with her and say hello. Robin mirrors the emotions of a person it is talking with, they explain. If the patient is laughing, then the robot laughs along. But if they're sharing something difficult, its face reflects sadness and empathy. In nursing homes, Robin plays memory games with people suffering from dementia and takes them through breathing exercises on difficult days and offers them a form of companionship that resembles a grandchild with a grandparent. So this will be interesting to see how this is integrated into their system. If you want to hear more about that, you can head on over to that article. I don't have time to go through the whole article. There's a lot to it. But if you had experience with Robin the robot, let me know what it's like for you. And what do you think about that? All right, here we got a couple more stories, and then we'll be wrapping up. Says VA doctors warn cuts privatization threatens veterans' health care. This is from The Guardian. More than 100 doctors who have practiced at the U.S. Department of Veterans and Affairs, the VA, issued a mass letter on Wednesday raising urgent concerns about Trump administration's policies that they said will negatively affect the lives of all veterans. The letter sent to congressional leaders Doug Collins, the VA secretary, and the agency's inspector general marks the first time VA physicians have spoken collectively about staffing cuts and aggressive privatization moves at the nation's largest integrated healthcare system. We have witnessed these ongoing harms and can provide evidence and testimony of their impacts, said the letter, which was signed by roughly 170 physicians, psychologists, and other healthcare workers in all. If the trend continues, these current and former staffers said VA facilities may be forced to close and veterans may be forced into costlier, often overburdened community health systems ill equipped to meet their specialized needs. Attorneys say the letter is protected under federal whistleblower law. The letter raises concerns that widespread staff cuts are being made without clear objective or assessments of their impact on veterans' access to health care. It also says rapid growth in the outsourcing of veteran health care to private doctors threatens to divert resources from the VA's high quality direct care. Agency officials assert that these changes are aimed at reducing bureaucracy and will not undermine medical services for veterans. Collins has said he's simply giving veterans more choices for quality, timely health care, whether at VA facilities or with doctors in the community. In response to Wednesday's letters, VA Press Secretary Peter Kasperowitz said VA is serving veterans much better under the Trump administration than it was under the Biden administration, and the numbers prove it. Oh, okay. What are the numbers then? He pointed to a recent announcement of infrastructure improvements at agency facilities and the fact that the VA has made it easier and faster for VA enrolled veterans to access care from non-VA providers at the department's expense. 69 active VA physicians signed the letter. Organizers said joined by about 100 others, including former VA physicians, as well as current and former VA researchers, psychologists, physical and occupational therapists. Many chose to sign anonymously out of fear of retaliation. The letter doesn't mention Trump by name, but it delves into the major changes that have occurred at the agency during his second term in office. The doctors titled their missive The Lincoln Declaration after Abraham Lincoln's call in the second inauguration address to care for those who have borne the battle and their families, remarks which serve as the basis for the VA's mission. So if you want to hear more about that, head on over to that story as well. Again, we don't have time to go into the entire story. There's a lot more to it. We just don't have the time, unfortunately. I told you it's going to be a heavy, heavy news day. So head on over to The Guardian if you want to hear more information about that. Okay. All right. So I think this is going to wrap us up because now I decided that it's going to freeze. So let's go ahead and get started on some information about what's happening in our local community. So first thing we have for the rest of this month. Okay, not much going on for us here at Baxter Professional Services, except tomorrow evening. If you want to join us for our Alignable event, you can go on over to Alignable and register for that at alignable.com and go to our Anderson Alliance. We are having our table talk and networking feast. We've got about 10 people signed up for this event. So come and join us. We'll be out at Thai Divine at 6:30. This is a networking event for small business owners. If you want to come out and get to know other small business owners in the area and network and how we can support one another in business, this will be a great time. So join us for that event. Obviously, you are responsible for your own costs for your dinner, but otherwise, come out and join us for the event tomorrow at Thai Divine at 6:30. On October the 1st, we have our basic TB validation course. So if you are needing to get your basic TB validation course, head on over to Baxter Professional Services Healtheducation.com and get registered for that class. On the October the 8th, we have our full BLS CPR certification class. Starts at 9 o'clock. You can go to the Baxter Professional Services Health Education for that as well. So sign up for that class. There's a lot of community events that are happening as well. Starting on October the 15th will be, we've got the prayer breakfast. No, wait, that's next week. October the 15th, we have the TB instructor course. Sorry, the TB instructor course. If you have had your basic validation through the Indiana Lung Association and the State Department of Health, you had your basic validation, and you are a nurse or a other healthcare professional with a 4-year degree and a license, and you want to teach TB. And we need more instructors too. If you want to teach TB to your facility or whatever, this is a good time to get scheduled for that. That will be October the 15th. You can join us for that course as well. And then we have on that day, we're having our podcast power, how to get booked on podcasts and make an excellent podcast guest. That event's coming up. Head on over to the nurseSharkAcademy.biz and register for that event there. This event, there's no cost to attend this event. It's complimentary. This is a great time for you to learn about being on podcasts. If you ever thought that you wanted to promote your business, your book, your project, whatever you're doing, and you want to get booked and speak on podcasts, but you're not sure how to do it, and if you do get booked, what do you say? This is a great event for you. We're going to talk about this. This is a great seminar. So just register for that. It's virtual, so you can do it wherever you are. You can do it in your pajamas. I don't care. Just get registered. Head on over to the nurseSharkAcademy.biz. All right. And then we do have, yes, I was right. Okay, so on October the 15th will be the prayer breakfast. So that is that morning. October 15th is the prayer breakfast for the Anderson, Madison County Black Chamber of Commerce. No, that's the 16th. I'm sorry, that's October 16th, which is that Thursday, is the prayer breakfast. And that will be out at Energy Impact. And then on the 17th, October 17th, is the President's Reception, and that will also be out at Ivy Tech Community College on East 60th Street. And you can register for that event at amcbcc.org. I'm going to put that into the show notes, into the comments, so you can get the website. So that event, so you got one on the 16th, which is the prayer breakfast in the morning, out at Energy Impact at 9 a.m. You still need to register and be there about 8:30 to get checked in. So go to the website and register for that. And then that Friday evening is the President's Reception. That Saturday morning, starting at 8:30, we'll start registration for that. Will be the Anderson, Madison County Black Chamber of Commerce Women's Conference. So that will be on the 18th, and starting at 9 a.m. And then on Sunday, October the 19th, starting at 4 p.m., will be the Anderson, Madison County Black Chamber of Commerce annual dinner, awards dinner, and banquet. You'll need to get your tickets. Those tickets are $40. You can get on the website, tell them Tina sent you. You can get on the website, you can go to that event as well. So you have several events coming up in October, community events. If you have a community event and you want me to give you a shout out for it, let me know. I'll be happy to do so. So let me go ahead and post that website there to our comments so you can pick that up. So go to amcbcc.org and register for that. Don't forget all of our events that are happening for the Nurse Shark Academy, and also for the health education as well. Okay, so that's that. That ends our show for today. We're right at 6:04. So we'll be happy to see you next week. We start a new quarter. So if you haven't got your business goals for the last quarter of 2025, what are you waiting for? Let's get that done. Let's end the year with great momentum. Happy fall, y'all. See you next week. Thanks for tuning in. Don't forget to like and subscribe and hit the notification bell so you know and go live every Wednesday at 5. And also, if you're on Facebook or other platforms, please give us a like and a comment. We appreciate that. Share this out. Invite more people to the stage. We encourage you to watch the show. Thanks a lot. Have a great day.